NCLEX Practice Test 2026 National Council Licensure Examination, Full Course NCSBN Model. Question 1. A nurse is prioritizing care for 4 clients. Which client should be seen first? A client with a fever of 101 degrees Fahrenheit. A client complaining of 4/10 pain. A client with new onset shortness of breath. A client waiting for discharge papers. Shortness of breath, ABC, airway/breathing/circulation, is the highest priority. Question 2. A client with type 1 diabetes is shaky, sweaty, and pale. What is the priority action? Administer insulin. Check blood glucose level. Give the client a high-fat snack. Document the findings. The symptoms suggest hypoglycemia. Checking the glucose is the first step. Question 3. Which task is most appropriate for a nurse to delegate to an unlicensed assistive personnel, UAP? Performing a dressing change. Assisting a stable client with a bed bath. Administering oral medications. Teaching a client about a new diet. UAPs can perform ADLS and tasks on stable clients. Nursing processes like teaching/assessment cannot be delegated. Question 4. A nurse is preparing to administer digoxin. What is the priority assessment? Check the blood pressure. Auscultate the apical pulse for 1 full minute. Assess for a cough. Check the temperature. Digoxin can cause bradycardia. The apical pulse must be checked and held if 60. Question 5. Which of the following is a symptom of fluid volume excess? Dry mucous membranes. Crackles in the lungs. Poor skin turgor. Weight loss. Crackles, edema, and weight gain are signs of fluid overload. Question 6. A client is scheduled for surgery and the nurse realizes the consent form is not signed. What should the nurse do? Sign it for the client. Ask the spouse to sign. Notify the surgeon that the consent is missing. Proceed with the surgery. The surgeon is responsible for obtaining informed consent. The nurse ensures it's documented. Question 7. When using the Glasgow Coma Scale, a score of 3 indicates normal functioning, deep coma/brain death, mild impairment, confusion. The lowest possible score is 3, indicating severe neurologic impairment. Question 8. A nurse is caring for a client with a suspected hip fracture. Which position is most appropriate? High Fowler's. Prone. Immobilized with a pillow between the legs, abduction. Trendelenburg. Abduction prevents further injury or dislocation of the hip. Question 9. What is the antidote for heparin? Vitamin K protamine sulfate. Naloxone. Glucagon. Protamine sulfate reverses heparin, vitamin K reverses warfarin. Question 10. A client is receiving a blood transfusion and develops chills and low back pain. What is the first action? Slow the infusion. Stop the infusion. Call the doctor. Give Tylenol. Chills and back pain suggest a hemolytic reaction. Stop the infusion immediately. Question 11. Which lab value is the most critical to report for a client on Lasix, furosemide? Sodium 135 milliequivalent L potassium 2.8 milliequivalent L creatinine 1.0 mg dl. Bun 15 mg dl. Lasix is a potassium-wasting diuretic, 2.8 is severe hypokalemia, normal 3.5 to 5.0. Question 12. A nurse is caring for a client in restraints. How often must the restraints be removed for assessment? Every 8 hours. Every 2 hours. Once a shift. Every 4 hours. Restraints require assessment of skin and circulation every 2 hours. Question 13. Which finding is a late sign of hypoxia? Restlessness, cyanosis, tachycardia, anxiety. Cyanosis is a late sign, restlessness and anxiety are early signs. Question 14. A client has a prescription for warfarin. Which food should the nurse tell the client to keep consistent? Bananas, green leafy vegetables, spinach, milk, bread. Warfarin is affected by vitamin K intake, consistency is key. Question 15. The 5 rights of medication administration include: right time, right car, right color, right patient, right drug, right dose, right route, right time, right doctor, right nurse, right pharmacy, right cost, right label, right size. These are the core safety checks for meds. Question 16. Which type of isolation precaution is used for tuberculosis, TB? Contact, droplet, airborne, standard only. TB requires an N95 mask and a negative pressure room, airborne. Question 17. A nurse is teaching a client about a clear liquid diet. Which is allowed? Milkshake, apple juice, orange juice with pulp, yogurt. Clear liquids are transparent at room temperature. Question 18. What is the priority when a nurse finds a fire in a client's room? Extinguish the fire. Rescue the client. Activate the alarm. Close the door. Race, rescue, alarm, contain, extinguish. Question 19. A client with a chest tube has continuous bubbling in the water seal chamber. This indicates the system is working normally. An air leak. The suction is too high. The tube is blocked. Continuous bubbling in the water seal chamber suggests a leak. Question 20. Which position should a client be in for a lumbar puncture? Lying flat on the back. Side lying with knees pulled to chest, fetal position. Sitting upright leaning back. Prone. The fetal position opens the space between the vertebrae.